Hello all, welcome to today's lecture on vitamin K. Myself Dr.R.Surekha, lecturer, Department of Biochemistry, SRM Dental College, Ramapuram. As shown in the picture, the vitamin K is widely distributed in all green leafy vegetables and fruits. Vitamin K is otherwise called as anti-hemorrhagic factor because vitamin K is required for the blood coagulation function. The vitamin K deficiency causes uncontrolled hemorrhage or uncontrolled blood flow. This is the structure of vitamin K, which is the naphthaquinone derivative. In the structure, you can see a methyl group and side chain attached to the naphthaquinone derivative. So in the side chain, if you have 20 carbon structure, then the structure is called phyloquinone, that is vitamin K1. If 30 carbon structure is present as a side chain, that the structure is called menoquinone, which is vitamin K2. If H atom is attached as a side chain, then the structure is called menadione. This slide again shows you the structure and the presence of vitamin K. So vitamin K1 is called a phyloquinone, which is present in the plant cell. So the phyloquinone will be having 20 carbon side chain, which is the vitamin K1. Vitamin K2 is menoquinone, which will be present in the intestinal bacteria, which will be having 30 carbon structure as a side chain. These two are the phyloquinone and menoquinone are naturally occurring because it is present in the plant and the intestinal bacteria. Whereas vitamin K3 is menadione, which is synthetically produced. So all the commercially available vitamins are in the form of vitamin K3, which is menadione, which will be having only H atom as a side chain. This slide depicts the natural sources of vitamin K. As you all see, the vitamin K is widely distributed in all green colored vegetables and fruits. So the kiwi, broccoli, lemon, spinach, grape, green grapes, green apple, lettuce, avocado. These are some of the important sources of vitamin K. Coming to the nutritional requirement of vitamin K, the recommended daily allowance of vitamin K is 70 to 140 μg of vitamin K per day. Because vitamin K can, some extent, can be synthesized by the intestinal bacteria. So the requirement of vitamin K per day is just 70 to 140 microgram. Coming to the absorption and transport, once the dietary vitamin is absorbed in the duodenum, it will be carried with the lipids to the liver through chylomicron, where in the liver it can be stored. Because fat soluble vitamins can be stored in your body, same way vitamin K can be stored in the body in liver. The vitamin K has two important functions to do in your body. The first, it helps in blood coagulation. It plays a vital role in blood coagulation. Secondly, it is involved in the bone formation. So these two roles are widely played by vitamin K. Mainly, vitamin K is involved in the blood coagulation because the vitamin K post-translationally modifies some of the clotting factors such as clotting factor 2, 7, 9 and 10. These clotting factors, first they are synthesized in the inactive form in the liver. So the inactive form of the clotting factors will be converted to active form by the enzyme called gamma glutamyl carboxylase. So for the activity of the gamma glutamyl carboxylase, vitamin K is required. So the explanation is shown in the next slide. So the vitamin K plays an important role in the activation of the clotting factors. Once the clotting factor is activated, then the coagulation function can be taking place by binding with the calcium ions. This slide shows you the vitamin K cycle. So the dietary consumption or oral supplementation of vitamin K will be converted to vitamin K quinone in our body. This will be converted to the active state or the coenzyme form, that is reduced vitamin K or vitamin K hydroquinone. This is the coenzyme form of vitamin K. This is required by the enzyme gamma glutamyl carboxylase. So the gamma-glutamyl carboxylase, it just helps in conversion of inactive clotting factor into active clotting factor just by adding the carboxyl group to it. It helps in carboxylation reaction. So the non-carboxylated clotting factors such as clotting factor 2, 7, 9, 10 will be converted to its active form, that is carboxylated active clotting factors. So while conversion, the reduced vitamin K will be converted to oxidized vitamin K, that is vitamin K epoxide. This vitamin K epoxide will again be reused or recycled back to vitamin K quinone by vitamin K epoxide reductase. So the entire process can be inhibited by the anticoagulant warfarin. So the warfarin inhibits the activity of vitamin K reductase and vitamin K epoxide reductase. So the conversion of vitamin K quinone will not be taking place. So the vitamin K quinone to reduced quinone on the oxidized vitamin K cannot be recycled back. So this entire process will be collapsed with the presence of warfarin. Hence, the blood coagulation will not be taking place. Thus, the warfarin acts as an anticoagulant, where vitamin K helps in the blood coagulation function. This slide shows the second important function of vitamin K, that is the formation of bone or for maintenance of proper bone health. Because vitamin K plays an important role in carboxylation of glutamic acid residues, not only present in the clotting factors but also in the osteocalcin protein. So the osteocalcin, which is a calcium binding protein, will be activated or accumulates calcium only in the presence of vitamin K. So see here the a picture showing after the calcium from the intestinal absorption with the help of vitamin D3, it will be reaching the osteocalcin, which will be in the inactive form. The activation of the osteocalcin is done with the help of vitamin K2. So the inactive form of osteocalcin will be converted to active osteocalcin. Once the osteocalcin is activated, which can accumulate the calcium ions, so the calcium incorporation or calcification of the bone can be taken place. So vitamin K also helps in maintaining the proper bone health. This slide shows you the causes and features of deficiency of vitamin K. Some of the causes involves impaired absorption of lipids or malabsorption of lipids, because vitamin K is absorbed along with the lipids and travel by the chylomicron to the liver, transported by the chylomicron to the liver. So if there is any malabsorption of lipids, also affects the absorption of vitamin K. And second important cause is sterile bacterial flora or prolonged antibiotic therapy, because I told you in the beginning itself that the intestinal microorganisms can produce some amount of vitamin K in your body. So if you are undertaking any antibiotic therapy for a long time, or any drug which clears all the bacterial flora of the intestine, that can also affect the vitamin K in your body, the vitamin K level in your body, which in turn leads to development of some of the features such as hemorrhagic disease of the newborn, bleeding, uncontrolled bleeding will be seen, and because vitamin K is an anti-hemorrhagic factor. So if vitamin K supplementation is not proper, hemorrhagic deficiency or hemorrhagic disease is seen, bleeding is seen, prolonged prothrombin time, and delayed clotting time. These are some of the features of vitamin K deficiency. So this is the symptoms of vitamin K deficiency: bruises from bleeding into the skin, nosebleed, bleeding gums, bleeding in stomach, blood in urine, blood in stool, tarry black stool because of the presence of blood, and extremely heavy menstrual bleeding. In infants, it may result in intracranial hemorrhage. That means there's some blood clot or blood bleeding in the brain. Hypervitaminose is also possible with vitamin K, because the excessive dose of vitamin K can accumulate in your body and leads to hemolytic anemia and jaundice. Also, vitamin K is used in therapy as antidote, which can the drug which can counteract the effects of poison, like dicameral type drugs. The poisonous behavior of dicameral can be counteracted by vitamin K. Hence, vitamin K can also be used as a therapeutic drug. Dicameral and warfarin are structurally similar to vitamin K. The dicameral and warfarin are anticoagulants. These anticoagulants can directly inhibit vitamin K epoxide reductase and vitamin K quinone reductase. These two enzymes are required for the regeneration of active form of vitamin K. So, if vitamin K is not regenerated, then the coagulation function will not be taking place. Thus, dicameral warfarins are anticoagulants. And this is a picture showing you the warfarin, which is structurally similar to vitamin K, which is an anticoagulant, whereas vitamin K is a coagulant, blood coagulation, involves in blood coagulation function. So that is all about vitamin K. Thank you.